You're on.
Well, good evening. This is the Northwest Indiana COVID-19 update for Wednesday, April 15th. I'm Michael Puente, and on your left side of your screen is Bill Moran of the Bill and Callie Show. We're trying to do this little partnership to bring you the latest news on the COVID-19 pandemic here in Northwest Indiana. Bill, thank you so much for joining me here today.
Oh, no problem. Thank you for allowing us to do this.
No problem. Well, we'll get to the latest numbers because there's always a lot of numbers to share about this pandemic because it's always changing. It is starting to get a little calm, but we don't want to get too optimistic here. So we'll get to it. The last time I got a chance to speak to people on Facebook was last Friday. So the Indiana State Department of Health is reporting 49 new deaths from COVID-19 for a statewide total of four. Wait a minute. Here we go. Sorry about that. I'm getting a little ahead of myself. The Indiana State Department of Health is reporting 49 new deaths from COVID-19, and that's for a statewide total of 436. The Indiana State Health Department is also reporting 8,955 confirmed cases for the virus, an increase of 440 from Tuesday. 48,396 people have been tested. That's 2,400 more than just yesterday. And in Northwest Indiana specifically, Lake County now has 876 people confirmed for COVID-19 with 33 deaths, 4,110 people tested. I know that's a lot of numbers, and in radio and in TV, you don't like to throw a lot of numbers to people, but I think it's very important to know the numbers. So Porter County, 130 confirmed cases, 2 deaths, with a little bit more than 1,000 people tested. LaPorte County, 42 confirmed with 4 deaths and 588 tested. Newton County, 29 confirmed, 2 deaths, 83 tested. Jasper County, 19 confirmed, 1 death, 250 people tested. And Stark County, 10 confirmed with 1 death and 106 people tested. I know that's a lot of numbers. And today, as he's been doing for the past 3 weeks, Indiana Governor Eric Holcomb held his daily press conference. And this is a little bit as to what he had to say down in Indianapolis.
While much of our lives has slowed down or maybe come to a halt, on the other hand, life goes on. And we're dealing with some of the same challenges, whether it's feeding the hungry or if folks need rides places to pick up their meds, and these mayors just epitomize that effectiveness and that leadership. And so we'll have a couple more mayors on next week as well, so folks can understand that we are truly in this together as a state, as our local government, and our federal partners.
And Governor Holcomb talked a little bit about what everyone's been talking about. When are we going to reopen Indiana? This is what he had to say about that issue.
If you look at it in terms of where we are right now, we're still letting, and we'll always be in this situation where we're letting the data drive our decisions. And so we're looking at the cases, and we're looking at the deaths, and we're looking at our testing capability to get to the most vulnerable, to our first line responders, et cetera. We're also contemplating how we're going to be able to track former positive cases and how they've recovered and at what stage they're in, ready to return to when we do reopen on a larger scale. But in terms of how we will reopen or re-engage on the economic front, it'll be a rolling reopen. It won't be all at once. It won't be flipping a light switch. It'll contemplate, as you say, and we're working with the business community. I'll later today be communicating to multiple and various associations throughout the state of Indiana that are soliciting their input on how they can safely, when that day comes, conduct business.
And Governor Holcomb also talked about how when the state does reopen, it's going to be kind of done in a regional sort of setting. So when New Albany opens, that doesn't mean Whiting is going to open. Or when Evansville does it, Fort Wayne may be not doing it. So because we live in the state of Indiana, but we kind of live in regions. We're in the Chicagoland region. So this is what he had to say about that.
As early as today, on multiple occasions, I've been in touch with the governor of Kentucky, Andy Beshear, and the governor of Ohio, Mike DeWine. I've also reached out to the governor of Illinois, and we've reached out to the governor of Michigan. So I want to make sure that we all know, because we're neighborly and share a border, and for every action, sometimes there's an equal or greater reaction. And so we don't want to we're not going to act alone in this. We're all in this together, wherever you start in the state of Indiana. And as you rise up and get to a higher altitude, travel patterns are affected by the coronavirus, or the coronavirus affects travel patterns, and vice versa. So yes, to all the above. Again, we'll have a very, when the numbers warrant, when it is safe to start.
And that's Governor Eric Holcomb. Now, Governor Holcomb also touched upon this controversy that drew national attention. Comments made by Republican Congressman Trey Hollingsworth on WIBC in Indianapolis about basically choosing to open the government with business and or saving lives. And this is what Congressman Trey Hollingsworth had to say that caused a lot of stir nationally.
It is always the American government's position to say, in the choice between the loss of our way of life as Americans and the loss of life of American lives, we have to always choose the latter. There is no zero harm choice here. We are going to have to look Americans in the eye and say, we are making the best decisions for the most Americans possible. And the answer to that is unequivocally to get Americans back to work, to get Americans back to their businesses.
So a lot of people took that as, choosing money over life. So Governor Holcomb was asked that, and his reaction to Congressman Trey Hollingsworth's comments, this is what the governor had to say.
Well, it's not an either or choice or decision. I want to get us back to work as soon as it's safe, and that's my job. That'll be our priority. And just to repeat, not to sound like a skipping record, but to repeat, we'll do that when it's safe to do that. We want a safe workforce on the ground as soon as we can get there. But the measures and the practices that we're taking right now are helping us get there.
And that's Governor Eric Holcomb. Now, a little bit earlier today, I had a chance to, so there's this good feeling down at the State House that things issues are going according to plan with COVID-19. But maybe things aren't as hunky-dory as they seem. Let's see.
Just continue.
So here's the thing. There's some other audio. I had some lined up, but I'm trying to look for it right now. Give me a second here.
I hesitate to say this.
Okay. So a comment made today by Indiana State Health Commissioner Dr. Christina Box about feeling confident that the things are getting better in Indiana in terms of the numbers, in terms of deaths, confirmed cases, sort of like flattening that curve, so to speak. And this is what she had to say about that.
I hesitate to say this, but I do think we may be seeing a flattening of that curve. So I'm cautiously optimistic that everything that we have done has really tremendously made a difference.
And that's Dr. Christina Box, Health Commissioner for the state of Indiana, trying to sound a little bit optimistic. Now, the situation, is kind of tenuous still in Northwest Indiana because we're still having cases rise. We're still having issues with testing and getting those tests back done quickly and confirmed. So I had a chance to speak a little bit tonight with Gary, Indiana Mayor Jerome Prince. And this is what he had to say to me a little bit, especially he sent out a letter yesterday, a sort of a letter to the editor, sounding the alarm that not enough was being done in Northwest Indiana. And this is what the mayor had to say.
Just continue to stress the point that we have a very vulnerable population. We put a lot of efforts into it. And, in one regard, as I was writing it, I could see that perhaps someone would perceive it incorrectly. But at the end of the day, I didn't say anything that wasn't accurate, right? We need resources here, and we need them now. And so that was the essence of it. It was just a further reiteration of what I had previously said to anyone who would listen.
And do you feel that, I mean, not pointing fingers at anybody, but well, I mean, you can point fingers if you want. Um, is the state allocating, or whomever is in charge, allocating enough resources to the effort?
Just continue to stress.
Sorry about that. I pressed the wrong button. Wait a minute. That, I mean, not pointing fingers at anybody, but well, I mean, you can point fingers if you want. Um, is the state allocating, or whomever is in charge, allocating enough resources to the effort in Gary, considering it has a high minority population, high African American population, and that is the demographic that is most at risk with this virus?
Well, I think it's a fair question, especially when you look at the statistics that are coming out across the country, right? But I try to place everything in respectable order. And in doing so, I'd have to admit that since the inception or the beginning of our engagement with COVID, right? And this dates back to March the 2nd, we've always had some concerns about testing and the availability of it. But I got to tell you, we're seeing improvements, and I believe it's a matter of just being able to articulate our position, having those open lines of communication with the healthcare providers here, with the state, obviously, and specifically the governor's office. And so, I think that we have a good working relationship, and as I always say, there's always room for improvement in everything you do. And at the point that you don't think you can improve, I think that's the point that you certainly should start to prepare for things to digress. But I'm okay today, I would say. That's Gary, Indiana Mayor Jerome Prince. You can hear more of my interview with Mayor Prince on my show Off Mic on Lakeshore Public Radio at 11 on Friday. And a portion of that is going to make it into a piece I'm doing on WBEZ Radio in Chicago, who I work for. Now, tomorrow, Thursday, April 16, Governor Holcomb is expected to have yet another press conference. And usually on Thursdays, we get information about unemployment numbers in Indiana. And it's been pretty ugly, of course, in the last month. I think the last count was about 330 Hoosiers have filed for unemployment benefits. And those numbers are expected to rise. How much more? That remains to be seen tomorrow. So again, just to go over the numbers from the Indiana State Health Department, there are now, 436 total deaths in the state of Indiana from COVID-19, 49 new ones as of today. 8,955 people have tested positive. That's more than 400 from yesterday. And a little bit more than 48,000 people have tested positive or have been tested. 48,000 people have been tested. So that's about 2,400 people more than just yesterday. In Lake County, 876 people have been confirmed to have COVID-19, with 33 people dying. Porter County, 130 people tested positive with 2 deaths. LaPorte County, 42 positives with 4 deaths. Newton County has 29 positives, 2 deaths. Jasper with 19 positive and 1 death. And Stark County with 10 positive and 1 death. And down in Indianapolis right now, they've got 3,200 people, more than 3,200 testing positive and 155 deaths. And it had been running as of last week 4 to 5 times more testing in the Indianapolis area. And Lake County, actually, the numbers have gone up for testing because Indiana State Health Department did a sort of drive-by testing site in Maryville last week for first responders and essential workers. And they continue that in Gary this week. But testing has been down. And if you go to the Indiana State Health Department website, they do have quite a bit details in there about demographics and deaths by race. So that's been a really big deal, and that's going to be continue to be a big deal in in Lake County. So
Bill, you're on here with me. You do your own show, the Bill and Callie Show, and I thank you so much for helping to produce this tonight to show the graphics and some of the music and just trying to get that information out there. I started this as a service because, as you know, Bill, we love I love my colleagues at WBEZ and at the TV stations in Chicago. But right now, we're not getting that coverage, that nightly coverage of information. And that's why I did it when it seemed like the world was falling apart. And for many people, it still is. They're losing their jobs, they're losing their incomes. We're seeing testing go up, trickle, but it just feels that maybe we're starting to feel complacent or feeling good about it when, of course, then again, the testing still just hasn't been there in Northwest Indiana. No matter what they're saying down in Indianapolis, they're trying to paint a rosy picture on it, and it's starting to get a little bit mushy down there. So, Bill, how have you been seeing it? How have you been taking this all in?
Well, one thing, I've been looking at the numbers. Of course, this is something we don't do on the Bill and Kelly Show, but I do. You can't help but look at the numbers because you get alerts all the time from the Indiana Health Department. I go on and look at those. The scary part for me is looking at the test and knowing that we can't test everybody, and to get a true number of how much impact this virus is having, you truly have to test everyone. Now, is that possible? No, it isn't. But I just ran the numbers in Lake County, which is kind of scary because what kind of lets me know kind of what we're look in the window of what we're looking at. We're now looking at 78% of the people that have been tested in Lake County have tested positive. I got to run that again, but that's a pretty scary window when on the state average we're looking at 18%. Now I'll rerun that again, but man, I ran it twice, and that's what I'm coming up with. So it lets me know something is happening in Lake County, and everyone points to the African American or the minority population has a higher instances of testing positive, and that you look at the makeup of Lake County, and you do have a higher population of minorities. So and that's scary. Are we looking at a higher impact area in Lake County? But when we get into this political conversation, and it's a balancing act that our elected officials are having to do is, do we open up the economy? And if we do, at what risk? So that is a balancing act that scares me because I don't think we truly know. I've listened to some of the internet, some of the World Health Organization, and they just put out, I think it is a 6-point recommended plan before you open up or relieve any of the guidelines that they want you to follow, and they're very specific about having controls of the virus. Making sure that you are in a controlled state. And so I encourage everyone to go up in the World Health Organization and look at those 6 points. And I got to say, I don't feel as a citizen that we're anywhere near controlling this. So if we're starting to open up part of the economy and we're not in control of the virus, to me, logically, it's going to start spreading again. And then it calls the issue, what are we looking at? A quality of life versus saving lives. It's evident that, right now, look how much money has the federal government put towards relief effort and economic relief effort. And they're doing this with a severe reduction in tax input. So, it's a balancing act, quality of life versus saving a life. And and again, it always comes back to me, and I look at those control mechanisms that the World Health Organization is recommending, and I don't think we're anywhere near it. And
you bring up the World Health Organization, where the president is now, threatening or is withholding funding from the World Health Organization during a pandemic. Other people can comment on it. To me, it doesn't seem smart. But he has his reasons, and also at a time where he's talking about not having postal service anymore. So there's a lot of things that are happening. Try not to get too much into the weeds on the national and things that the president says, and try to keep it mostly focused on Indiana and Northwest Indiana, because that's the only thing we can control, or can't control it, but at least report it on. It's closer to report on. Let the pundits worry about what the national people are doing. But Bill, you're right, because if with Trey Hollingsworth said about, yeah, we got to open up the economy, and he's kind of on that diatribe, which the president has also been clamoring for. What is going to be the risk to businesses? Are they going to then require their employees to sign a document saying, okay, you're coming back, but you can't find us at risk if you get sick? That's going to be the thing, because if you sign something like that and you get sick, do you get sick on the job? Can you not file for workman's comp? Can you not file for any number of things? So there, I mean, we are going into kind of a dicey time. I will say this, in that we if when we do go back to work, we're going to have a lot more information with us. We're going to know about the social distancing. We're going to know about covering the mouth. We're going to know about, if you're sick, stay the heck home. So we got a lot more knowledge on how to keep each other safe. Now, listen, we're going to continue to hear about people getting sick. And are we going to freak out about it? Are we going to, because we know there are people who get this and don't get sick, but then there are people who react differently. The numbers on the Indiana State Health website does give a lot of good information about demographics. And I think the one thing that sticks out to me about the people who are getting sick with this, it kind of does, it seems like those people from infants to 20-year-olds to 30 years old, actually, you're pretty much safe. 1% for 30 to 39. 50-year-olds, about 7%. Now in that 60 to 69% age range, 20%, 70 to 79, 30%. You're usually already retired by then. 80, 39%. And it's almost like 2-to-1 in terms of males versus females, males getting the brunt of that. And but in terms of death, also in the upper age groups. So I don't know if that's good news or bad news if we were to go back to work and everything on that.
Yeah.
But those are the numbers. But at least we would have more information in terms of protecting us. But going back to work, it's going to be a different environment. You got a lot of people who are clamoring to get back to work, but then they're kind of scared to go back out there.
Well, the manufacturing plants, what
Yeah.
the increased precautionary cost to that, and who's going to pay for that? Is the federal government going to come forward and say we're going to assist with the additional protective gear? Because at that point, they, to really protect everyone in the workplace, they're going to have to wear protective gear. And one thing that popped in my mind as you're talking about the statistics is, you and I talked off air about this, is we have a guest that has come on several times from New Zealand, and the way they're dealing with this is vastly different. And it's hard to compare those two numbers because the population is different. But if you compare the state of Indiana to New Zealand, they have a higher population but a lower death rate. Now, one interesting statistic that they track that and correct me if I'm wrong, Mike, is that they track people that are exhibiting symptoms but have not been tested yet. Otherwise, they're like waiting, and they publish those as their national statistics, so you can kind of get an idea of, I guess, a better idea of what's going on. And I guess I would like to see them do that here. Otherwise, what the medical community has identified, people that they placed in quarantine, they're because that brings back to the issue again. That is another scary part. Are we truly know everything that we know to start working on this? And
What's the thing about that, Bill, is that we're still, it seems like we're still just figuring out this thing on the fly.
Right.
We don't have a lot of good studies. People, I mean, we're dealing with other things like, does this Proquil or whatever this drug is it good to treat coronavirus? Just because the president says. I mean, how do we get to that point where instead of medical experts and testing and making sure, you're taking something that could kill you and make things worse, all because we're living literally in really strange times. Everything is just getting so muddied up. You're talking about these tests tracking people. Heck, we're just trying to get the testing, enough testing for everybody, and we're not even there yet.
Right.
If you hear some of the comments though of Dr. Christina Box, it's almost suggesting that anybody can get them, because she's
Mm-hmm.
saying you have to be an essential worker. They were having testing at St. Timothy's in Gary, for essential workers, first responders, people in healthcare, and family members of those people, without a doctor's excuse. It's kind of opening the floodgates and kind of not. But then again, I'm still hearing reports from people in Gary, people in Porter County, that there's not enough testing. I spoke to
Mm-hmm.
a gentleman with the Porter County Health Department who told me that, and I wish I had his name in front of me, and I'm drawing a blank, so you don't think I'm talking outside of my head here. He tells me that right now they only are given to do 5 tests per week. Five
Mm-hmm.
tests per week. That they have the capacity to do 100 tests per day. So 5 per week to 100 per day. The problem is that they don't have the resources to get the results back faster. There's a local laboratory in Valparaiso, I don't want to say their name, that is somewhat price gouging. They want $130,000 up front to do the testing quick. You're talking about a national pandemic, and they're worrying about they want to charge a county. They want to give the county a thousand tests, uh, but they want it at $130 per pop, $130,000 up front for them to do the results of this test. I'll just say that their initials are GL, but you can look it up yourself.
Yeah.
So this is
But
this is what I've been told from somebody who's head of, or at least, here. You know what? I don't want to guess.
and
Well,
the
we'll
attorney.
just say
Yeah.
that the situation isn't as glowy as they seem to be wanting to point in Indianapolis. And we do know that some of the reports that have been coming out, we do know Indiana is a very Indianapolis centric state.
Mm-hmm.
What happens at the state capitol, that's their focus. And it took a while for them to start paying attention to Northwest Indiana. And they are a little bit, they had the remote testing last week in Maryville, a little bit in Gary, but it's been tough to pick up, and it's those stories that we got to continue to monitor, because we don't really feel safe going back out there right now. Cook
Yeah.
County is still exploding with more cases.
Mm-hmm.
They're not going down. Maybe this is part of that new normal, so that's why
Well,
people are feeling good about it.
I
I don't
think the
know.
other thing that is endangering us, quite honestly, and it may be why Lake County's numbers are somewhat skewed. We religiously do not go out without a face mask now, but when we do go out, we're noting people that they're just in flat denial, and that is the other bothersome part of this conversation. Is the only thing that the World Health Organization and the CDC have stated repeatedly, that the only thing that they know how to control this virus is by social distancing. And when you have a number of the population who just is not agreeing, even though they're endangering themselves, not only legally, but they're endangering us, you've got that to deal with then. In all these controls. And I think that in Chicago, they stated they are finally seeing their curve level out.
Mhm.
But their population, I guess, is adhering to it. But boy, when we went out this weekend and this week, it's like people just were acting normally. We went into a store, and we had our face masks on, and some of the workers did not, which was bothersome. And some of these were places that handled food items. Now you can't ingest this virus, but still, the plastic that can transfer the virus, so that's bothersome. I just don't think we have taken this seriously enough for us to be under total control. And
Well,
be
when you have this pulling back and forth, it started off with the media is overplaying this,
Yeah.
the president downplaying this, not knowing what social distancing is, not having enough masks, not having enough PPE, fighting over that. It's been a mess since this thing started. Now, I've never lived through a pandemic, and or at least one that I know of, not like this. So I'm not sure how much better it should go. It is a it's a pandemic, excuse me, and there's nobody else in this studio, so I have nobody else to infect. And I got Lysol. I'm gonna fumigate this thing as soon as I get off this air. I got everything here.
Yeah.
So, but it's been sort of a mess. You know, it almost reminds me of the bear season, where it just nothing went right. And I hate to
Or
make a
the
joke
sock
about
season.
this
No.
and keep it light, and it's a
Yeah.
very serious issue, but it's just like nothing has gone right for us. And until we get some of the basics in line, enough PPEs, enough testing, getting those test results back fast, um, I don't know where we're going with this. And as soon as more people get to be left out or back in to society, um, I don't know. We have one question. George Lara on my Facebook asked, with more layoffs and jobs being lost, what are the chances that Congress will approve a second stimulus package? Well, I don't know what the chances are, but they had been talking about that really early on, that there would be maybe two checks. Now, that that'll make it up to what, $4 trillion. How are we gonna pay that back? I don't know. But after that, I mean, the longer this goes, a lot of the stores, a lot of retail restaurants, that are, the longer this takes, man, I know some of them, they just may not come back. There may be nothing back to
Yeah.
come to.
Given the first round of funding, I think what they need to do is increase the efficiency that they're delivering the stimulus fund. I'm talking to company owners who still have not gotten the appointments and gotten their paperwork filed for their small business SBA loans, stimulus loans. And I've talked to people who have still not gotten their check for their unemployment. So there's a delay from the original stimulus. So it would be good to know, but then what state is the federal government going to be in? How are they going to be? We're looking at a devaluation of the dollar, definitely, because it's printing more money. And it's a balancing act it's dangerous. But yeah, the stimulus funds. In fact, I'm supposed to be getting mine today. By the way, I saw that it's kind of interesting. After they deliver about half the funds, they put out the IRS put a link out there where you could track the delivery of your check. And yeah,
Oh,
thanks for that. They're almost all delivered already. So, but I guess
oh,
it's going to help when it comes to the second round. But yeah, boy, it is not in an ideal. But are we in an ideal situation? No, we're dealing with a hidden enemy, and but that's attacking us both economically and that's what my question is: how long can the federal government sustain this? Um, you know, I, even at the local level, because there's no taxes being paid in a lot of cases. More money's going out.
right. I
So,
mean, yeah, more money's going on. At some point, it's going to dry up, even for government.
mm-hmm,
And that vaccine can't come quick enough. But we know a vaccine is not going to be there for at least a year, if
a
not
year.
more.
And like I
So,
said, the one thing that the all the doctors have told us, both nationally at the World Health Organization down, is the only thing that they can tell us is separation and stay at home. And that's are we going to be looking at a society where we're working from home? We have to figure out how we do this without going out in public. That's going to be interesting. That draws in the entertainment industry. What is the entertainment industry going to? Is it going to survive? All the restaurants. How is that going to look for the restaurants? And the people that earn money in those restaurants. So it's yeah.
yeah. Well,
To,
Bill, I want to thank you for this.
oh,
There's
no
one
problem. No
last
problem.
thing on my Facebook page, sir, for our ask. Any comparisons with numbers in surrounding Midwest states? I've only been tracking Illinois, but I don't have those numbers in front of me. Lake County's reporting is still poor. There's no breakout or city or towns. That's really sad. Let's see. Do the mayors get reports of number of cases in their cities? I think so. And but you're right. They haven't been broken down like that. I don't know why. We do know in Gary they do release the numbers at last count. I think there was about 110 confirmed cases. I'll correct that. I think there was about the last number I saw was about 180 confirmed cases in Gary,
Wow.
5 deaths. So that number is going up in Hammond. Um, I know Mayor McDermott releases those numbers periodically. I don't have them in front of me. I should, and I'll have them during the next broadcast, either tomorrow or Friday, and we'll get those numbers. But I'm not really sure why they don't do that already. East Chicago has never released their numbers, or at least I've never seen them. Um, Maybe it's not to freak people out, or just just assume everyone's going to have it and just stay away from them. So
Well, now,
we're
like,
going to wrap this up, Bill. I
all
want to
right.
thank you so much, Bill. You can see Bill. He has his own show. It's not this depressing. It's called the Bill and Callie Show. They're doing a bang up job. They have their studios there in Hammond. The
So
new
after
Gloria
Michael depresses
Renovation.
you with all the facts, we try to put a smile on your face. So it's really a scam that Mike and I have working on. So no, it's not putting a light in this,
Bill's got
but
a great voice. He'd be great for radio too. And
oh,
they have
thanks. Good
a lot
for
of
radio. I've got a
great
radio
guests.
face.
Bill and Callie Show.
Yeah.
And you can catch it on Facebook. He's everywhere, and they do a great job. Callie's always fun to
Oh yeah.
watch, and I'm on their show periodically talking about beer or whatever, drugs or
Yeah.
whatever.
And we
So
do, but given it, we do have to take this very seriously. At some point, to keep our mental health, we do have to maintain some type of levity. It may sound black humor, but yeah, at some point, we've got to keep a positive attitude and hope for the best.
that's
So,
right. Right.
so
Well, we're gonna wrap this up tomorrow again. I'll try to be back on Facebook Live, hopefully with Bill, maybe not with Bill. Bill's very busy. So, but again, tomorrow, Governor Holcomb is gonna have is expected to have another press conference. We're gonna get the updated unemployment numbers. We haven't seen this week, to my knowledge, the Indiana State Superintendent of Schools. Maybe she can give us an update. A lot of people concerned about a lot of families out there without internet access or had it and is having to cut back because their income is going down or they don't have any income now. So how are they going to get this instruction to the kids? Very important questions. We're not out of the woods yet. Um, it snowed today, so maybe you don't feel that bad going out, but we'll bring you the latest numbers. And thank you very much for watching this. Hope you enjoyed this and hope you feel this is a valuable service. You can hear me again on WBEZ. I do also help out our media partners, Lakeshore Public Media in Maryville. That's where I'm at now in the Northwest Indiana Bureau for WBEZ in Lakeshore Public Radio. Support your public radio stations, either in Chicago or Northwest Indiana. They're depending on it. Support your local newspapers, Post Tribune, Sun Times, Northwest Indiana Times, Chicago Tribune, journalism. It's almost like a religion to me. I take it very serious. We're going to try to keep you safe. Nobody's pushing for a collapse of our economy because it affects our family, your families. We want to see it through. So hopefully you can share this link, this video, and hopefully I provided you a good service, valuable service. So good night, Bill. Thank you for
good
doing
night,
this with me.
Michael.
It was great.
Thank you. Thank you. We'll talk to you later. Good night.
Good night.